My name is Sara Lerner. I'm a licensed audiologist and assistant director of audiology here at ENT and Allergy Associates. I have the unique opportunity and privilege to work with a team of over 120 audiologists in over 50 locations over New York and New Jersey. Part of my role is to help our team really logistically and clinically and to assist with their patients' hearing needs for hearing tests, balance testing, and hearing aids. So there's about 3 reasons, or there are 3 reasons, genetics. This really could be over the lifespan at any time. So either, born with hearing loss or delayed, whether it's during childhood or later in life. Aging, unfortunately, over 25% of people older than 60 years old are affected by debilitating hearing loss. And then disease. So chronic illness such as heart disease and diabetes have a hearing loss as a side effect. There's also ear-specific diseases such as otosclerosis, which is caused by the stapes, which is a bone in your middle ear that hardens in place and then becomes stuck, which causes a significant dampening of the sound waves and in turn hearing loss. Another example of an ear-specific disease is Meniere's disease, which causes hearing loss, but also severe dizziness, tinnitus, which is ringing in the ears, as well as the fullness sensation and severe, like I said, severe dizziness. So who wants to really raise awareness of the impact of hearing loss, as ear and hearing problems are among the most common problems encountered in today's communities? Over 1.5 billion people globally live with hearing loss today. So with that, noise is now being acknowledged as one of the most important health issues and a top environmental risk that is faced in the world today. With that, this is all extremely important, as untreated hearing loss can have negative impacts on cognition and social and emotional well-being. Yeah, so as we talked about before, there's lots of factors that are out of our control, but we could protect our hearing by limiting noise exposure to loud sounds. So first, just simply turn down the volume. You can walk away from loud noise. If you have to be around loud noise, it's really important that you take breaks from it and then use hearing protection. Many people don't like to use hearing protection, but if you find earplugs or earmuffs that are comfortable and reduce sound just enough to make the noise at a safe level, you'll much more likely to wear consistently. So I highly recommend playing around with that or contacting an audiologist to get custom plugs made. Yeah, so we spoke a lot about protecting your ears against hearing. So I'm going to leave you with, if you're noticing any significant signs of hearing loss, whether it's asking for repetition, feeling like people are mumbling, or even noticing that it takes a little bit of extra effort to listen to conversation, the first step should really be to be evaluated by an audiologist and an ENT physician. Hearing loss could be caused by something as simple as a buildup of earwax. So as a team, we will determine whether or not you have permanent hearing loss and what you could do about it. So as I mentioned earlier, hearing loss is often the symptom and not the disease. So it's important that first we rule it out to make sure that there's nothing medically or surgically that could be done for it. And if there aren't, hearing aids might be recommended. They are incredibly sophisticated devices these days, and many times are nearly invisible, and they could significantly improve your ability to hear and in turn improve your quality of life. Finally, the current buzz in the hearing world is OTC hearing aids, or over-the-counter hearing aids. It's a really great option for some, but for the majority, it's not a great option. So my best recommendation for you, if you want to look into OTC devices, first really get your hearing evaluated by an audiologist. From there, we'll make appropriate recommendations whether or not you are a candidate for OTC or you should consider prescription hearing aids.